Hello, today we will be doing an assessment of the abdominal area using tangential lighting so that we can visualize everything that we need to see in the abdominal area. The first thing we will do is we will ask the patient to flex his knees up as to relax. That's good right there. To relax the abdominal muscles. And we will inspect for contour, and it should be flat, and his is. We'll also inspect for skin characteristics, noting any the skin color. We will inspect for any bulges, any observable masses. Is there any bruising? We want to note if there's any striae, if there's anything abnormal to visually see on the skin. That is what we will be inspecting for. Also, we will inspect the umbilicus area, noting if there's any bulges. Then we will move on to auscultation, and we will do auscultation. We will do auscultation next because we don't want to disrupt the bowel sounds with percussion and palpation going first. So what we will do is we will auscultate all 4 quadrants, starting with the right lower quadrant first, using the diaphragm of the stethoscope. We're auscultating for vowel sound frequency and character, and what you will normally hear, it will sound like clicks and gurgles, and you should hear that 5 to 35 per minute, and his vowel sounds are active and present. Next, we will percuss, and one of the first things we will percuss is the span of the liver. Starting in the right lower quadrant, and at the mid-clavicular line, what we will do is we will percuss downward until we hear the sound. We go from tympany to a dull sound. And we will mark that off. Then we will start in the right lower quadrant and percuss upward. And then we will mark that. And then we will take and measure between the 2 marks. And a normal reading would be from 6 to 12 centimeters, and his is within that normal range. Now we will also percuss the spleen. Percussing downward, and then I can also percuss upward. And also we will percuss for the gastric bubble in the lower Next, we will move to our palpation, and we will begin with a light palpation starting at the right lower quadrant, palpating for any tenderness, any guarding, feeling for any masses, bulges, and then we would move forward with a deeper palpation palpating for any rebound tenderness, any guarding, any masses, and any bulges. We will palpate around the umbilical area, noting any hernias, any bulges, and anything of that nature. Next, we will ask the patient to while we were auscultating, we failed to listen to the arteries, and we'll do that at this time. We'll listen to the aorta. Using the bell of the stethoscope, you listen to the aorta. Listening for any bruise. Then you'll listen also with the bell of the stethoscope for the renal artery, the iliac artery, and the femoral. Right and left side. Now moving back to our percussion, we've percussed palpating the liver, the spleen, and what I will do is have the patient just lift just a tad bit. And the spleen should not be palpable. And the gallbladder, which should not be palpable either. And the kidneys. Next, what I will do is have the patient sit up slightly. Where I will it's what you can see it. Pulse in the costovertebral area, assessing for any tenderness, and there are none. And that concludes our assessment of the abdominal area.